Lovely. So I just want to welcome you all this morning to this session on supporting people with dementia at home. My name is Emer Begley and I work with the National Dementia Office, and I've been invited to chair this session. So I'm delighted that we have four great speakers who are going to talk us through a number of presentations for the next hour and 15 minutes or so. We have Fiona Foley, who's National Co-ordinator of the Understand Together in Communities campaign. We have Eibhlis Cahalane, who's project lead for the Memory Technology Resourcing Programme. Fiona Keogh, who is Senior Research Fellow at the Centre for Economic and Social Research on Dementia in Galway. And we've Bardin, who is Operations Manager in the Alzheimer Society of Ireland. So a good starting point, I suppose, to introduce this session is just to acknowledge that the majority of people with dementia live at home in the community. And the impact of COVID has been significant on us all, I think, but nearly more so for people with dementia and family carers. And this is largely due to the fact that services have had to pause, or there's been cessation or change of service, but also that there's increased anxiety due to the restrictions, the public health restrictions in response to COVID, and the loss of social interaction or reduced social interaction as well has been a major challenge for people, and also on family carers as well. So each of our speakers this morning is going to touch on COVID, but they're going to talk to us more generally about different services, supports and programs. Each speaker has 15 minutes for their presentation, and this will be followed by a questions and answer session at the very end. So please feel free to put in your questions into the chat box. I'll be keeping an eye on it. Or if you have any points for clarification as well, please do type in your questions there. So I'm not going to hold you up any longer, and we'll get into the meat of this morning. And our first speaker is Fiona Foley. I'm delighted to introduce Fiona. Fiona is going to talk to us about creating dementia inclusive communities. Fiona worked for 10 years in Germany as a manager before she followed her Irish roots and came back to Ireland in 2009, where she was appointed to establish the charity Eibhlis, a charity that looked at providing and promoting physical activity for older people and people with chronic conditions. Once she was well settled in Ireland, and because of her own experience, family history of dementia, she joined the Alzheimer Society in an operations role. And in 2008, she was seconded to the Health Service to take up the role as National Co-ordinator of the Understand Together in Communities campaign and develop the national framework for the campaign. And she's been with the campaign. We're lucky enough that she's been with the campaign ever since. So Fiona's going to talk us through work that's happening on Dementia Understand Together. So again, I'll say it again, please put any questions in the chat box as you're listening. I'll hand you over to Fiona.
Thank you very much, Emer, and thank you very much for having me here at the conference. I'm delighted to be speaking to you, and thanks everybody for joining today as well. So I'm just going to share my screen here and go through the presentation with you, because I think it's always easier when you have a few slides as well to look at and to guide us through the talk that I'm having today. So I'm the National Coordinator of Dementia Understand Together, as Emer said, and many of you may be familiar with the campaign, but I just briefly speak a few words about the campaign as well, and what the aim of the campaign is, before I go into how you can also get involved in it and help us make a difference for people with dementia in our communities. The campaign is led by the HSE, but it's always been a key to the campaign that it's a collaborative approach. So it's partnered by the Alzheimer's Society and by Age Friendly Ireland as well. And in addition to that, of over 40 national different organisations who are supporting the campaign. It started off as a TV campaign, but everything that was happening with the campaign was based on research. So there was research on the impact dementia is having on people with dementia and their families. There was literature review. We had focus groups with people with dementia as well, and all the findings really showed that there is a lot of stigma still is related to dementia. There is still a misunderstanding of dementia in our communities, and still a lack of awareness as well, and that really leads to loneliness and isolation of people with dementia. So just going to go through the next slide. So we looked at what could be the key objectives really, and what are we trying to achieve with the campaign. And the key was that we could start to create an Ireland that embraces and includes people living with dementia and displays solidarity with them. And how do we do that? And the first step was to build awareness and understanding. And the second step is to inspire people, individuals, businesses, service providers, everybody in our community to take actions to support people with dementia. So the building awareness part and understanding was really that first TV ad, radio campaign, and also the website where we had a lot of information. And again, it was key that people with dementia were involved in that. And you can see Maureen here in the picture. And Maureen was, spoke about her own experience with dementia in the TV ads, but she's continued to be part of the campaign, as are a lot of other people with dementia as well. And that is really fundamental to what we're doing. We measured the impact of that first 2 years of the campaign, of the TV ads, the radio campaign, and so on. And we could see that there was a huge change in attitude and understanding already. And that was really important for us to see that there is some shift in people's understanding, because we can actually build on that then to make a difference in local communities. So what are the outcomes that we are hoping to achieve in communities then? And again, we asked people with dementia what would make a difference to them in their communities. And they told us that it is that people are understood, respected and valued, that they can stay socially connected and engage in community life if they wish to do so, that local businesses and amenities are responsive to people's needs, and that the built environment is accessible. So these are all things that mean the same to us. Like, it's no difference. We all want these things in our communities. So it is really about thinking of how can we change our communities to make them inclusive of everybody, and what does that mean? So we really have to think about the culture that we have in our communities to make that kind of change. So we needed a shift also of the culture of dementia in Ireland, because as I said at the beginning, there was still a lot of stigma. There's still a lot of isolation and loneliness out there for people with dementia. So we need to change the culture that we have around dementia in Ireland. And we can only do that by the way we think about dementia, the way we act, and the way we interact with people with dementia and with one another in our communities. So that means we all have a role to play. Every individual, every organization, every business has a role to play in this. And when you ask yourself, well, how do we do this? What do we do? Where do we start? And you imagine yourself being that little dot, one of these little dots, and you think, God, I can't really make a huge difference. Well, we are all part of this growing social movement of people are actually taking actions. And if you just think that you're one of these dots and you're talking about dementia, or you're going to visit a neighbor or a family member, or you speak in a community setting about dementia, then that means that you're growing a network of people who have a better understanding, who see how they can get involved, and it starts spreading across Ireland. And that's how culture change spreads, by all of us taking these actions, by all of us speaking about dementia, by all of us looking at the simple things that we can do to support a person. So we are not alone in this. As I said at the beginning, it's really key for us that this is a collaborative approach. There are over 40 national partner organizations working with us on this, and more than 340 community champions have said they want to be involved, they want to do something in their communities, which is absolutely fantastic. And again, when you look at these partners, it is about imagining, your community. So you need your public transport, you need to go to the post office, you need to go to the shops, you want to go and sit in a coffee shop, you want to be in a park, you want to be in a library. So all of these partners are involved in the campaign, and they're all taking actions to make communities more inclusive. And many of them are involving people with dementia in these actions. So they've held workshops with people with dementia and asked them what would make a difference for them when they're traveling by train, or when they went into the GAA museum and they asked them, again, what would make a difference to you to actually be able to come into the museum and participate in the things that they're offering here. So that involvement, again, is really key in making a felt change for people with dementia. Our community champions are really active out there as well. So they holding information talks in communities. Some of them have set up support groups. They've set up cafes as well. And they're linking in with other groups as well and with local councils and organizations to raise awareness for dementia. So again, we evaluated how our partners and champions are working out there. And we asked them whether they felt that their work has actually made a difference so far. So we asked them whether they felt people had a better awareness and understanding in the organizations themselves, in their wider networks, and in the wider community. And as you can see here, national partners and champions felt that there was a shift, that there was a change in awareness and understanding just through the actions that they were taking themselves as well. And just a few quotes here at the bottom, people have said, it has made integration a lot easier. It is great to have a national program that is trying to achieve what we are trying to achieve locally. So it is really great to see that people see this program as a platform as well to link in, to connect, and to help them as well to take actions in their communities and to spread the word about those actions as well. Then, of course, we thought we were all set in 2020, continue with our work in our communities, and then COVID hit. And, people with dementia have been really massively affected by COVID. And, whereas people have been isolated and lonely before, it really showed how much the lack of services then that were closing just to keep people safe, but also the social interaction, the being out as part of your community, how that has really impacted people with dementia. The Alzheimer Society published a report in July, Caring and Coping with Dementia during COVID-19, and it really shows that people with dementia felt lonely, isolated, trapped. Family carers felt that there was no time off, depression, loneliness. These were all comments coming back from people. So we had to look at how are we going to adapt our work to be able to support them and continue to do our work as well to raise awareness in the communities. So we also asked our champions, because many of the champions might not have been able to go out into the community again either, and they might have been redeployed into different settings. And they might have been impacted themselves as well. So we asked them, have you been able to still do actions and take actions in your communities? And thankfully, 64% of them actually said they were. And these were actions where they shifted some of their activities. So instead of having face-to-face social groups or cafes and so on, they picked up the phone and reached out to people with dementia. They sent letters. They continued to raise awareness through online events, virtual cafes and so on. So it was really heartening to see that. But we also asked what kind of supports would be important for our champions and our partners to continue their work as well, so that they can continue supporting people through this time. And they felt these, champions cafes, learning and networking opportunities that are online would be really supportive to hear what are best practice examples at the moment, and also just still to have campaign resources such as an inclusive design guide or tip sheets and so on that they could send around or hand out. So our key objectives for the campaign stayed the same, but we adapted the content and the method of delivery in order to still support champions, partners, and people with dementia. The first thing we did, and I'm sure you recognize all the yellow, when COVID hit, there were a lot of yellow posters, a lot of yellow information, and it was quite confusing actually to find, what is the real relevant information for me as a person with dementia, for a family carer, that I need to be aware of at this time. So together with the IDC, with the National Dementia Office and the Alzheimer Society, we looked through all of these resources that were available through different organizations. And we put them together into one document so that people really found by theme what was key and relevant for them at this time to keep them safe and to keep them engaged as well. We also created a weekly activity planner because that social interaction was missing and the routine was missing, but it meant that you could still continue doing things from your home as well. And every day there were different activities that had a link to an online gallery tour, to an exercise class, or to other resources as well. And Emma O'Brien from the Memory Technology Resource Rooms, she created an at-home activities booklet, and we were delighted to work together with her to put that together in a booklet and in a resource. So again, lots of different resources for people of activities that they could do at home. For us as well, it was really important that we continue raising awareness for dementia and better understanding, and training has always been key for this. So we decided to host online trainings now. So all of our trainings are also available online. Hopefully we'll be back to face-to-face in the near future, but until then we just continue online, and it actually gives us a chance as well to reach a wider audience too. So we have a dementia awareness training that is, you know, relevant for community groups, and we're just rolling this out for all of Tipperary at the moment, which is really fantastic because you can reach different communities within Tipperary now to become dementia aware, and we're rolling this out for businesses as well. But we also noticed when we talked about the built environment and making that accessible for people with dementia, that people might not have a real understanding. What does that mean for a person with dementia? How are they affected by the built environment, and how can we design our environments, our parks and our buildings to actually be accessible? So we also created with our partner DDS Architects an inclusive design training. So again, that's available for, you know, councils, town planners and so on, and others who are interested in it to learn more about inclusive design. And then we're also partnering with the Azure program, because again, it was important that we can still continue running out the Azure program and to support galleries and museums to host the Azure program themselves. So this is an online program now as well. Key for the campaign has always been communication and sharing what is happening out there in our community, so that people can be inspired, so that people see what are the different actions others are taking. So through our social media, we publicize all of the different activities in communities, whether it's from partners or champions, and whether it's the virtual cafes or the fact that Boots has trained, you know, the majority, all of their staff members in stores now, pharmacists on dementia, the guards activities, you know, on being a good neighbor. But we also now have our own networking events. So with our partners and champions, and you can see the Zoom image there, coming together and sharing the things that they are doing and learning from one another. So stories are really the most powerful way for us to connect, and we need to continue talking about dementia, because that is how people feel involved. That is how people can be inspired as well. And people with dementia, again, need to be at the heart of this. So two things that I just briefly want to talk about is a local newspaper campaign that we did, and also a local radio campaign. And again, it was all about letting or sharing the voice really of a person with dementia, carers, healthcare professionals, and our community champions, and giving information out of what kind of alternative supports are still available. So we published a 4-article series and a press release that had different themes on how you can get involved in the campaign, but also learning about the use of technology, and also knowing more about the new stats regarding dementia as well. And the local radio partnership, again, involved people with dementia, and across the country, we had 10 radio stations, and for a whole week, there were 2 interviews per station, and they were really fantastic because people were just reaching out and talking about how they were affected by COVID-19, but also showed the resilience that people have really had throughout this time, the messages of hope that were really important. And the key for these 2 pieces, for the 2 local campaigns, was that people with dementia feel that they're not forgotten during this time, that we are still reaching out, that we're still involving people with dementia, that we're looking at ways of how we can do that, and that people with dementia likewise can be involved and speak out, and that we give them a voice. So the next steps for the campaign is that we want to continue to inspire everybody to get involved. So please contact me and get involved. We want to continue to grow the network of partners and champions taking action. It's really important for us that there is a local link between organizations, their branches and champions so that they can work together. And Tipperary is a fantastic example for this now, where there are many different initiatives and people are working together. And we want to do that for all of the counties in Ireland. So we are engaging closely with key collaborators. So it's the Alzheimer's Society and Age Friendly Ireland and also Healthy Ireland to use all of their national structures so that we can roll out this campaign even further. We have a lot of campaign resources. You can find them on our website, and that includes also all the radio interviews that I've been speaking about. So there are 20 there if you want to listen in. And these are just a few websites and resources that might be of interest to you. And I know the presentation will be shared later, so I won't call them out now, but they're available on different websites that I've put together. So thank you very much. And I hope that you will get involved, and I know there are many, many actions already taking place in communities. It's really fantastic to see that there is a shift, and it's really lovely to see people coming together and working together to make a difference for people with dementia in our communities. So thank you very much.
Thanks so much, Fiona. You gave us a really good sense of the campaign, and there's a huge amount in there. I think something that struck me was around linking and staying connected, and that's so fundamental to the work you're doing. And particularly now, I think all of us in communities staying connected and linking in together to support people with dementia who are living beside us, neighbours, or who've accessed our services. So thanks very much, Fiona. If you have any questions for Fiona, as I said, pop them into the chat box or the questions and answers box, and we'll come to them at the end. So I'm going to introduce our next speaker now, and that's Eibhlis Cahalane. Eibhlis is a qualified physiotherapist. She qualified in 1995, and she worked initially for 9 years in Dublin before she moved to Kerry in 2004 as a senior physio, and then as manager of physio services in Kerry, before moving to the National Office for Services for Older Persons and Palliative Care Strategy in 2015. And in collaboration with us in the National Dementia Office, she's led out on the assistive technology project since 2016 and seen the establishment of memory technology resource rooms throughout the country. The MTRs provide a very important resource to people with dementia and their families. And the MTRs are open to anyone who has concerns about memory, but they're primarily used by people with dementia and their carers. It's a great way for people to get access to assistive technologies and to get support and practical advice and solutions for difficulties that they encounter as a result of their memory impairment. Eibhlis, as well as all of that, is also a member of the Tralee Dementia Friendly Interagency Group, which is aiming to make Tralee dementia friendly through various methods. So there's a nice link there to Fiona's presentation as she links in with Fiona on the Understand Together campaign. So I'm going to hand you over to Eibhlis, who's going to talk about the recent evaluation of the MTRR rooms and also to give you a sense of what that service does. So Eibhlis.
As Emer said, my name is Eibhlis Cahalane, and I'm going to talk this morning on the evidence of the impact on the community memory technology resource rooms. So I'll talk initially on the memory technology resource rooms, just for any of you who are not familiar with what they are and what they do and how they've come about. And then I'll talk about the evaluation that was carried out on the memory technology resource room project in 2019. So I suppose the memory technology resource rooms are about predominantly about assistive technology. What is assistive technology? AT refers to equipment that enables someone to complete a task, to maintain their dependence, help manage risks at home, and reduce stress for carers. So this, I suppose, shares a huge amount of equipment in terms of from low tech to high tech. So everything from whiteboard reminders to maybe GPS tracking equipment and everything in between. Our project began in 2016 when the National Office for Service for Older People in the HSE, in conjunction with the National Dementia Office, we were given a dormant account funding to support and facilitate the expansion of assistive technology for older people, including people with memory issues and dementia who are living in the community. And so this began, I suppose, the establishment in 2017 and 18 and 19 of memory technology resource rooms. So what are they? So the MTRRs, as we shorten them to MTRRs, they showcase that wide variety of assistive technology equipment. They allow the hands-on experience of assistive technology to facilitate learning and experience of the products with the support and advice of a professional. In some instances, the clients can have an opportunity to trial the assistive technology, which may be suitable for them. And all the MTRs are staffed by part-time occupational therapists. So I suppose basically the rooms, they showcase this equipment And as I say, there's a wide variety of equipment there that can make a huge impact and significant difference to people's day-to-day lives. The fact, though, that the rooms are staffed by occupational therapists is very much one of the keys to the success of the rooms, because I suppose it makes a difference between just looking at equipment on a catalogue or looking at it on the internet, whereas when you have the professional who's skilled in the therapeutic benefits of assistive technology and also the precautions with assistive technology, this is what makes the difference to people who visit the MTRRs in terms of really finding value from the assistive technology and seeing what suits them at what stage. So it's the timely intervention as well is very important. Getting the right advice about the right particular type of equipment at the right time. But it's not just, I suppose, this AT side of it that makes the MTRRs such a success. It's also, I suppose, the fact that with the OTs and the professionals who manage the MTRRs, that they're very skilled in supporting both from the AT point of view, but also in supporting people from the emotional aspect in dealing, I suppose, with the diagnosis of such as dementia. And also they're very much practical based and give practical advice and lots of other tips and advice on memory strategies, etc. So it's these two elements of the MTR, we'll see this has come out in the evaluation, that I suppose make the rooms a success. So I suppose I've just showed here just a few examples of some of the equipment that's on display in the MTR. So your calendar clocks that can help with orientation, your easy to use telephones, again, that can make you know, a simple task that can be quite hard, I suppose, when you have memory difficulties, but which these simple devices can make a big difference. The next slide just shows the MTR based in Loughlinstown Hospital. And you can see it's quite a warm environment, and this was very much the ethos of the MTRs, is that it's a very non-clinical environment. So you can see this room is set up, I suppose, like to look like your own house, which really makes it a warm environment, I suppose, to come into for the person with dementia or memory difficulties and their families and carers. There's no white coats, there's no arduous memory assessments. It's about looking at the assistive technology in its real setting, so be it in the kitchen or the dining room or the bathroom. You can see the assistive technology in action. You can sit down, take your time, and really, I suppose, experience how possibly the memory or the assistive technology is going to make a difference to your life. And I suppose this will have been reported back from people who visited the MTRs. It's this warm environment that helps people often to unload their worries and their concerns about dementia, and also then it kind of really facilitates the learning in terms of getting their hands on the actual equipment and being brought through it. And the next slide here just shows you the distribution of the MTRRs throughout the country. And you see there is a good distribution throughout all counties. And there's a total of about 27 MTRs operating, and this includes 3 MTRs that were already in existence before our project. And you'll see 3 in red there that should hopefully be open before the end of the year, which will bring it to a total of about 30 memory technology resource rooms. And again, you can see a good variety of distribution throughout the whole country. So it was decided to evaluate the impact of the memory technology resource rooms in 2019, and we brought in an independent evaluation or research company, Work Research Centre, to evaluate the memory technology resource room project. And they were well suited to this research in that they have carried out quite a lot of research in the area of dementia previously. So again, it was a good mix and match to have the Work Research Centre working with us. So they provided that independent assessment, and they, I suppose, looked at the role and the contribution of the MTR programme. They examined the impacts and values for the clients who are accessing the MTR rooms, and also identified areas for enhancement and improvement. So the Work Research Centre, they took a very broad approach to the evaluation of the MTRRs, and they looked at, I suppose, both quantitative and qualitative data. So the next slide, while there's quite a lot on it, you can just see, I suppose, the kind of variety of data that the Work Research Centre worked with. You'll see here on the first line, the MTRs gather monthly activity in terms of referrals, appointments, and you can see in 2019 there was over 2,261 referrals with almost 1,900 appointments. Every month as well, the MTRs report back on visitor feedback. So when visitors visit the MTRR, we look for feedback in terms of how they found the consultation, and as well, I suppose, giving us tips on how to improve our service. So again, you can see the 895 feedback referral or feedback forms in 2019. So there was quite a lot of data there that the Work Research Centre were able to work with. But then they drilled down a little bit further by looking at kind of doing an ecosystem survey with about 20 MTRs during 2019, which looked at, I suppose, in more detail, the operating procedures and service assessments that were provided through the MTRs. They also looked at a pilot of looking at new documentation forms, again, which gave us more in-depth analysis of what interventions were provided through the MTRs. And this was with a cohort of about 107 service users. And then follow-up calls with clients. So when people visit the MTR, it's usually a once-off consultation, even though people are open to coming back if they so need to. But often, I suppose, when people leave, you want to know, well, have they found the information useful? Have they been able to put into practice? And in relation to the assistive technology, have they actually possibly purchased the assistive technology? Have they gone on to use it? So with a smaller, again, subgroup, 34 clients, the Work Research Centre were able to evaluate follow-up phone calls that were done with this cohort of clients that were able to give us feedback after their visit to the MTRR. So even though it was a small number, it gave us very valuable information. So next slide just kind of gives a very brief overview of some of the profile of the referrals that are received in the MTR in terms of age. And again, this would be, I suppose, similar to what one would expect, the majority of clients being over the age of 75. But again, you see the significant number here for under 65. In terms of the profile of the referrals, for those who have a diagnosis, again, that would be almost 60% of people visiting the MTRs would have a diagnosis of dementia. But again, quite a significant percentage who do not have a dementia diagnosis, and this may be that they're pre-diagnosis or undiagnosed. The MTRs are open to people, everyone who has a memory issue. So again, you can see a percentage there of clients who would have other memory issues. Our referrals come from a variety of sources, and again, I suppose a third of these are nearly coming from community services, be it primary care, social health, mental health, etc. Another third are made up, I suppose, from specialist services such as geriatricians, acute and memory clinic. You'll see it's quite a kind of a low referral rate there from GPs at 1.3%. So again, this is something that the MTRs will be working on continuously in terms of highlighting and I suppose advertising our service, because obviously GPs would be an important referral source for MTRs. So I suppose this next slide really, I suppose, is one of the most important slides in terms of the evaluation, because those in-depth ecosystems and in trials of the documentation that were carried out through the Work Research Centre really highlighted and detailed and documented the services that are provided through the MTRR service. And we kind of I've broken them up there into the AT related service and the non-AT related service. So the AT related service in relation to the assistive technology equipment. So as I say, there's showcasing equipment, but I suppose there's so much more. It's that information regarding the equipment. It's allowing the people to have a hands-on demonstration and advice regarding the setup of the equipment. This is all very important because, again, it differs between, just looking up something on the net. And again, if you're maybe a technophobe like me, anything that has too many buttons and alarms can be off-putting. Whereas if someone can come into a very relaxed environment, they're shown how to use the equipment, where they might be suitable possibly in the house, what they might help with, what they mightn't help with. All this information, it's really, I suppose, empowering the person with the memory issue and their family and carers to make an informed decision of maybe what may or may not work. Because I suppose, people want to avoid is people buying expensive pieces of equipment that obviously that may not help in the end, and that's frustrating. The MTRs also help in terms of sourcing the equipment and sometimes giving troubleshooting after people have gone on to actually purchase equipment. A loaning aspect of the MTRs as well allows people to actually trial out the equipment. So again, helping in making people make that informed decision before they purchase equipment. But the non-AT related support, but this is just as important as the AT related service and aspect of the MTRRs. So having occupational therapists who are skilled, I suppose, in therapeutic benefits of assistive technology, but also in the day-to-day practical advice that they can give. So they're able to give, I suppose, expert advice and guidance to families on maintaining activities and routines. And again, this became very, very important during COVID. Practical ways of memory strategies. signposting again onto the variety of services that are available in the community, be they back to sort of medical professionals, but also to all the things that Fiona would have mentioned in terms of cafes, choirs, etc. So the MTRs are very much placed in the middle of there in the community in terms of being able to be part of that cohort of services for people with memory issues. The OTs are able to assist, I suppose, and give practical advice in terms of activities of daily living, and can also give practical advice in terms of behavioural management if that does happen to be an issue with the person with dementia. And again, this is very much appreciated by their family members. Again, practical advice in terms of falls and safety, be it to do with the AT equipment itself or else just the environment of the home. And all of this, I suppose, gives a lot of support to carers, and this is what has come out in the evaluation, and this is what is coming out in the feedback. So again, I suppose having that skilled professional who can look at both the AT related side of things and the non-AT, really, I suppose you can see how the MTR provides such an umbrella of services. Again, this is looking at those 895 feedback forms that were received in 2019. You can see it's quite a high percentage were stated that the visit to the MTR was very useful. Qualitative feedback again that was provided from the visitors shows, you know, very positive quotes there that are coming back from the visitors, and you know it talks about a lot of different things in terms of the environment, how the advice are given on the assistive technology, how it is the reassurance, and I suppose that expert advice is really having a positive impact on people's lives. And that smaller cohort that we talked about that got the follow-up phone call, again, this provided very positive impact from the MTRs, and that 85.3% of these clients found the interaction very useful. 66.7% indicated that they'd actually gone on to purchase equipment. The most common types of equipment that were purchased at the time were the orientation, which has, I suppose, persons in orientation in terms of time and day, etc. And 72% of these clients and family members indicated that the AT purchase was very useful. So again, so although it was quite a small cohort, it really shows high percentages there in terms of the impact that their visit to the MTR and also that the advice really helped them in terms of choosing the right type of equipment. So I think this really, you know, gives us very valuable information in terms of the significant contribution that the MTRs provide. The MTR staff also provided feedback, and again, they referenced to a lot of things that I've mentioned already in terms of the positive impact of the MTRs, in that they provide that holistic approach, the holistic assessment for the client, awareness and advice regarding the potentially useful and also, more importantly, unhelpful AT. The fact that it's community resource post-diagnosis, the accessibility to the service, so easy to get to, you can self-referral, it can be a timely intervention. The fact that you're a dedicated professional, and the fact as well that they look at strength-based approach. So people leave the MTRs feeling, oh yes, there's things I can do, there's things I can continue to engage with. So that's very, very important. Obviously, COVID, as Fiona said, it has impacted everything, but COVID actually highlighted the role that MTRs play in supporting people with dementia and their families. From the assistive technology point of view, the safety and reassurance that this can provide to family members and carers, but also the MTRs were able to adapt to telehealth very quickly through calls, videos, and still were able to provide the same type of information and advice to families and people with memory difficulties. The evaluation included a lot of recommendations that we as a network of MTRs will continue to work on in terms of making sure that it's sustainable and that we grow into the future. So in essence, I suppose the evaluation really demonstrated that the MTRs provide a valuable contribution to supporting people living with dementia. They're a source of empowerment, education, support to people. They can improve the quality of life of persons with dementia and reduce their carers' stress, facilitates the visitors to make the informed choice of decisions, can help signpost people and families to other relevant services, and provide that safe environment where people feel, you know, I suppose, safe and happy to discuss the challenges they're encountering in their day-to-day lives. And just Fiona mentioned the Understand Together website there, and you can find all the contact details for the memory technology resource rooms that are available throughout the country are available on that website. And hopefully that you've got there from that brief discussion, just I suppose the impact that the MTRs play in people's lives and the positive impact they're having in I suppose contributing to the National Dementia Strategy in highlighting the awareness of assistive technology, and really, I suppose, do have a significant role to play in the community services for people with diagnosis of dementia and other memory difficulties. Thanks. I'm sure I've gone over my time.
That's okay. Thanks so much, Eibhlis. You've answered one of the questions that came up about access to the MTR. So it is by self-referral or referral from a HSCP, Health and Social Care Professional. So I would recommend people go on the Understand Together website, and you'll get all the information on the MTRs that are across the country. There's a couple of other questions in the chat box, Eibhlis. You might just type in the responses there, because they're very specific to your presentation. So without further ado, and in the interest of time, I'm going to keep things moving and introduce our next speaker, which is Fiona Keogh. Fiona is a Senior Research Fellow in the Centre for Economic and Social Research on Dementia in National University of Ireland in Galway. She has over 20 years experience in developing national policy and conducting health service research in Ireland, specifically in the areas of dementia, mental health and disability. Throughout her career, she has worked directly with people using health services in research and policy development, and she's had a very busy morning this morning, because she's already presented at a session this morning. So if Fiona is there, I'll hand you over to Fiona. I don't see her up there.
Yeah, I am.
You're there. Super, yeah. Fiona.
Hi.
Great.
Yeah, I'm here. Thanks for that, Emer. I'm delighted to be here at this session. I'm going to just share my screen so that we can see the slides, and hopefully they're all coming up now. Yeah. So I'm going to give a description of the Dementia Post-Diagnostic Support Grant Scheme in Ireland. And I did this work with colleagues. It was actually led by Dr. Maria Pearce, who's an independent researcher, and my colleagues in Galway, Anya Teen and Eamon O'Shea. We also worked with the National Dementia Office. This was funded by them, and the projects obviously implementing the interventions, and people with dementia and family carers have all contributed in different ways to this. So just to give you an overview of the support scheme, I suppose the wider context is the National Dementia Strategy of 2014, and it recommended a number of actions under the heading of timely diagnosis and intervention, and there's a recognised gap in post-diagnostic supports in Ireland. So the National Dementia Office put together a kind of a programme under the direction of a multidisciplinary and cross-sectoral support group. And they did various tasks, coordinated various tasks, including a needs analysis of people with dementia, a scoping exercise, and a literature review of the international evidence on post-diagnostic supports, which is conducted by myself and colleagues in Galway. And this was all to inform how we might move forward with the provision of post-diagnostic supports. And then money was made available through the dormant account funds. And this was developed into a grant scheme to kind of to provide seed funding, if you like, to increase the availability of post-diagnostic supports across Ireland, and to increase staff capacity to deliver these interventions. So they were the kind of the key aims of the programme, if you like. And 18 projects were successful and were grant funded to implement at least one intervention: cognitive stimulation therapy, cognitive rehabilitation therapy, or psychoeducational interventions. And just a brief description of each for those who aren't familiar. So CST is designed to stimulate cognitive abilities such as memory and thinking through a structured range of activities, and it's typically delivered as a group programme. And there are a number of different programs, but the University College London Making a Difference program is one of the most popular and evidence-based. In terms of cognitive rehabilitation, again, there's a couple of different types of interventions. The home-based memory rehabilitation was the most kind of commonly used one in this program. It's an OT-led program of memory rehabilitation, and it's through structure and repetition to develop new habits and routines. And the use of memory aids. And then psychoeducational interventions have, as the name suggests, an educational component around things like symptoms of dementia, treatments, legal issues, and so on, as well as a therapeutic component to support people with dementia and carers to kind of manage the circumstances related to their dementia, dealing with stress and so on. So the evaluation, the focus of the evaluation was an overall program evaluation. So we weren't looking at each individual project, if you like, of the 18 projects. It was about the overall program. And we were particularly interested in the implementation to find out what we could learn from how these programs were implemented so that we could bring this to scale this up, and the impact or the effect that the projects were having on the people using them, people with dementia and carers in particular. So we were really interested in describing the interventions, how they were delivered, the context, to assess the impact for people with dementia and family members, and to assess overall whether the grant scheme succeeded in addressing that post-diagnostic support and care gap. And how we did that, we did a few different methods. We reviewed the documentation of each project. We carried out a series of interviews with the project leads and the teams involved, and also attended a number of kind of educational and consultation meetings of those projects, and designed a data collection tool to collect kind of service, project use data. In terms of impact, we developed a specific form to measure the impact, and we used public and patient involvement methods with a group of people with dementia in Kilkenny to develop that form. And we based it really on kind of well-being domains and specific questions around each of the types of the intervention. And that was completed by 174 people with dementia and 61 family carers. And we collected data just for 6 months of the programme from January to June of 2019, but it ran for longer than that. Just to give you an idea of the numbers involved, there were 7 projects that delivered cognitive stimulation therapy, and 89 people with dementia participated during this time period. 6 projects delivered cognitive rehabilitation to 80 people with dementia and 64 family carers, and 6 projects delivered a psychoeducational intervention to 63 people with dementia and 76 family carers. You can see the totals there. One of the projects wasn't able to proceed really because of kind of recruitment difficulties, and that money was kind of reabsorbed back. So to look at it, I'm going to give you some of the high level findings in relation to each of the types of intervention. So those projects that were delivering cognitive stimulation therapy, they delivered that in a variety of contexts. So there was sort of daycare settings, community hospital settings, and also uniquely an acute hospital setting, where people were brought together from a number of wards in an acute hospital, and CST was adapted to deliver to a group on that basis. There was really, kind of good acceptability of the UCL, the University College London CST programme, which is called Making a Difference. And that's also been developed into a kind of a more open group format called a COGS Club. So that kind of was well accepted by the people attending. And I suppose there are a number of advantages to the CST intervention. It's quite adaptable to, as you can see, the different contexts, as it was delivered in different contexts, and also different formats. So it's been designed as 14 one-hour sessions, but they can be grouped together into typically into 7 two-hour sessions, so that it's not such a long program for people. And where people are in rural areas in particular, where it might be hard to get to a venue, it's kind of makes it more worthwhile for people to attend for a 2-hour session. So while adaptations can be made, I suppose we need to keep in mind the fidelity to the actual principles of the programme, because the evidence base is related to that kind of original design, if you like. So a number of staff delivering were able to get kind of in-person training or online training in CST. And that was very helpful and very important for those delivering it. But it's also, it's not just a matter of receiving the training. it's about the kind of skill set, if you like, or the experience of the staff delivering it. So staff who are experienced in delivering group facilitation, for example, is a very important quality. And also then flexibility in terms of their own work patterns, in terms of kind of maybe times of day and different settings. And a number of projects trained a wide variety of staff to deliver these. And it kind of didn't work so well if staff didn't have those kind of skills in terms of group facilitation and some flexibility in terms of how they were able to work to deliver it. I suppose what's important was the project that delivered it in an acute hospital setting. That worked really well, and it was very well received, and had lots of other benefits. So that's a useful model going forward. In terms of the cognitive rehabilitation interventions, the OTs were highly involved in the implementation, the delivery of these, I suppose because the intervention itself was an OT-led programme, and the one that was most frequently delivered as an intervention was the home-based memory rehabilitation programme developed by Mary McGrath. And they opted for that versus the kind of individual goal-oriented CR. So cognitive rehabilitation is typically delivered to an individual in their own home, but most actually of the interventions here were delivered in groups in different, again, a variety of different settings, often in a memory technology resource room, just described by Eibhlis, one of the other uses of that facility. And memory aids were widely used. So the memory aids that are typically used in CR programs are calendars, memory diaries, whiteboards, and prompts. Access to these was variable, but most projects used most of these memory aids. Some projects, I think, legitimately questioned whether all participants should receive all the aids as part of the process, as that's a bit one size fits all. And for some people, it might have been more beneficial to get some of them maybe a bit later on. The cognitive rehabilitation is designed also for people with early, earlier memory difficulties, and it reached its target group, which was very effective in reaching that particular target group. In terms of psychoeducational interventions, there was really a wide variety of interventions delivered. So unlike a CST and CR, there was a number of interventions. Most focused on dyadic, so that's both the person and the carer together in an intervention, but some were in groups and some were individual to the dyad. The individual dyadic interventions were more successful than the group interventions. And I suppose if we think about it in terms of the therapeutic component, people may be less willing to share some of those challenges in a group setting. And it's maybe easier to address some of those challenges with an individual or a couple themselves. The numbers going through the psychoeducational interventions were a bit lower, and there were a number of reasons for this. So there were delays in staff recruitment. I think bringing groups together for this particular intervention, the stigma of dementia seemed to be important, and some projects started to develop new interventions that took longer than expected. Some of the other issues highlighted, I'm just keeping an eye on the time here. The staff recruitment, if new staff had to be recruited, that was just a protracted process. So it kind of ate into the time that was available to deliver the interventions. So that's, I suppose, important in terms of scaling up this to take into account the fact that recruitment takes time. We learned about, I suppose, a wide variety of staff delivered these. So OTs, nurses, social workers, speech and language therapists, as well as assistant grades. And really what was most important was, rather than the discipline, was the experience and the skills and the motivation of the staff involved, and group facilitation skills being really important. Recruiting people into these groups also was quite challenging at times. So while we know there's a kind of demand out there, it can often be hard to find people at the right time and at the right kind of stage of their dementia for them to benefit in the optimal way. And this is really related to the diagnostic process. So if people aren't diagnosed, obviously they can't come to the attention of people running these interventions. And also links with memory clinics was very important, because that's, if you like, that's the best time to capture people as they're diagnosed and as they're looking for further assistance and support. So those links with memory clinics, with MTRRs, with other services, was they were the projects that were most successful in recruiting people into the groups. Family carers have an important role because they provide transport, they provide support for the person in maybe practicing what they're learning in cognitive rehab, and some of the skills they're picking up in the CST also. And access issues are always important in the delivery of these interventions, such as, you know, not just getting to a venue, but things like signposting at the venue and parking and so on. So we also, as I said earlier, surveyed or had a short little tool for people with dementia and carers to try and assess the impact on them of the interventions. And the overwhelming majority really rated the interventions very positively. For CST, the respondents really enjoyed the social interaction in the group, the opportunity to talk, the peer support that was provided, and they really wanted that group to continue. And for the CR groups, they found the tips and the strategies that they were learning very helpful. They also enjoyed the peer support from the group that was there, and the reassurance from being connected into services early on. There was positive feedback for the psychoeducational interventions on the individual dyadic interventions. They found the staff very knowledgeable, the kind of relaxed and calm atmosphere. They really valued being listened to and being heard in terms of their specific concerns. And there were also benefits for staff. They found this work very enjoyable and very rewarding. I think they could see how it was really useful to be able to link people into different services from where they came from, the memory clinic, and then to link them on to services and supports like Alzheimer cafes and so on. So just to conclude, you know, I mean, the international evidence has shown, and we've also found, that people with dementia can really benefit from, and they really value post-diagnostic supports. How we deliver that support is really important in terms of how we start to maybe scale up the implementation of these supports going forward. CST, cognitive stimulation therapy, is definitely worth scaling up in Ireland. We just have to pay attention to maybe uniformity and consistency and support the people providing it going forward and doing that. I think there's probably a little bit of thinking through in terms of the best approach and format for delivery of cognitive rehab. Although it's designed as an individual program, the group format has a lot to offer because the peer support is very valuable. It's probably not a useful use of resource and time to start to develop new psychoeducational interventions. There are lots out there that can be used, and they can be adapted if necessary. And the individual dyad approach seemed to be the most successful. To support wider implementation, as we know, additional funding will be necessary, and I know this has been a focus of the National Dementia Office in their work. But what's really noteworthy, and I think really important, is that 14 of these projects have continued their work, and they were either able to do so through their existing envelope of funding and adapting work practices, and the NDO sourced additional funding for some of these as well going forward. So I think overall it was a very successful program, and it's provided a lot of learning as to how we might do this into the future. Thanks very much.
Thanks so much, Fiona. It was great to have the evaluation of the grant scheme to see the impact, not only the impact, but the processes around implementing these types of programs. So really good learning in terms of supporting additional rollout. In the interest of time, I'm going to keep going, but I can see some questions coming in. So we're going to just hang on for maybe 15 minutes beyond the initial time, just to address some of those questions. So bear with us. Next up, we have Mary Bardin. I should have said at the top of the morning, I've worked with everybody in the session this morning. I've been very lucky to work with everybody who's participating in the session this morning. And Mary Bardin was a colleague from the Alzheimer's Society. So Mary has worked with the Alzheimer's Society for many years. Most recently, she took a post as operations manager in September 2016, and she oversees operations the eastern region of the country, providing leadership, developing and growing services. And the ASI have been instrumental in supporting people with dementia in Ireland generally, but even more so during COVID times. So Mary's going to talk us through some of the services and supports that enable people, I suppose, to stay well at home for as long as possible. So I'll hand you over to Mary.
Thank you very much, Emer. Good morning, everybody. I suppose it's afternoon now, but good afternoon, everybody. And as Emer said, I've been with the Alzheimer's Society of Ireland for, I suppose, the last 10 years. Really enjoyed working with the organisation. And I suppose our biggest challenge at the moment is COVID, and how do we continue to deliver services to people living with dementia, and particularly in the home now, due to our daycare centres all being temporarily closed due to the COVID-19 pandemic. The presentation, as I said, it's about supporting people at home. And we asked many people living with dementia, what does living and being supported in their own home mean to them? So let's hear what they had to say, because I think it's really important that we go to them and ask them how important it is for them, rather than us assuming. So one of the first things they said was, being able to live at home offers me a sense of comfort and independence. Being supported at home has helped me maintain and even increase my confidence levels. I love to go out in my garden. I share my home with my beloved pet. I know my neighbours and I love to hear the local gossip. I know where my things are. I have my favourite chair and I love my private space. I get to see my family members in my home when it suits me. It's past your bedtime, huh? I get to go to bed and get up when it suits me. I've lived in my home for many years, and this particular lady has lived in that same home now for 57 years. So it's very important to her that she remains in her home. Even during the coronavirus lockdown, I want to be supported to live in my home. This gentleman here, his name is Jim, he's 90 years of age, and he's been missing the iconic Irish stout ever since the coronavirus lockdown took away his regular trips to the pub. So Jim's spirits were well and truly raised when his family surprised him with a freshly poured pint of Guinness delivered right on his doorstep. And as we say in Ireland, the stuff that dreams are made of. So another thing that a lot of people said to us was, home is where my heart is. And we all know we're most happiest when we are at home where our heart is. So how do we support people living with dementia in their homes? ASI, as we all know, have a fantastic home care service that has been running for many, many years. And our trained staff work with people living with dementia to ensure that we meet their needs, and we provide support and practical information to the person living with dementia and their family carers. And you can see here was just a letter that was sent in to us by one of the recipients of our home care service. And this lady, who would prefer to remain anonymous, from Dublin, said, the difference to our lives has been enormous since Maeve, the home care worker, came. You can plan something on a Tuesday and Mum is in great form. All the family notices it. She is just so happy. So it's fantastic to know that we are making a positive impact in the lives of people living with dementia and their families by delivering home care. We provide one-to-one committed support to the person living with dementia, and it's important for us if we can achieve that it's the same care worker that goes in all the time to that person living with dementia. We provide conversation and companionship, meal preparation, personal hygiene and dressing, assistance at meal times, and also with exercise. And we provide respite from caregiving for the caregiver. So due to the onset of the coronavirus pandemic, the ASI had to temporarily close all their dementia-specific daycare centres nationwide. Closure of the ASI daycare centres meant that people living with dementia were no longer able to attend their daycare services. For those people living with dementia who attended our daycare services, the ASI were concerned for their well-being, lack of stimulation, exposure to isolation, and of course, loneliness. We were also concerned for the family carers who would now have to care for their loved one 24/7 without having a much needed and well-deserved break. So what did the ASI do to support people living with dementia at home during this global pandemic? ASI developed a new alternative support therapy for people living with dementia and their family carers during COVID-19 crisis. Through this project, the ASI were able to provide meaningful, therapeutic and age-appropriate activity or social engagement calls on the phone or via webcam to the person living with dementia and family carers in their homes, which are beneficial for both the person living with dementia and the family carer. Firstly, we communicated with the daycare clients and the family carers by phone and webcam in order to identify their social and recreational requirements according to their preference. We then engaged with the client either through a social engagement call or on a variety of activities which are stimulating and varied to promote well-being, fun, which is so important, and to reduce boredom. ASI designed activity packs for the person living with dementia and the family carers. Activity packs are distributed monthly to the person living with dementia and their family carers. In each activity pack, we have home activities booklet, a home weekly planner, and a home activities idea fact sheet. There are 3 ability levels of the packs available to suit the person living with dementia for those who are in the early stages, mid stages, or advanced stages of dementia. So there's some comments there from people living with dementia and their family carers in relation to that particular service that we developed due to the onset of the pandemic. One lady says, good variety of material, ideas to plan and do daily, loves the crosswords, loves colouring, family fun, words of songs, poems and puzzles. And in the red down at the bottom there, another person said, IDC are excellent, and I really appreciate what you all do. The fact that someone just chats to my mum a few times a week on the phone is great, and just what my mum needs. Loneliness is mum's worst problem at home, and she loves when people call her. And then up at the top in the blue circle, I feel supported. Not everyone understands what caring for someone with dementia feels like in the home. And down in the purple circle, it's wonderful knowing my mother isn't forgotten about. To know that someone is thinking of my mum while she is at home. So the other thing we did in the Alzheimer Society of Ireland was we decided, what would we do with our daycare services now that we couldn't provide the services within the daycare centre? As our daycare clients could not attend the daycare centre, ASI decided to bring the daycare service to them and provide daycare at home. ASI developed a new model of care called daycare at home. The daycare at home concept is to provide an alternative model of care and support to our people living with dementia and family carers at home. Daycare at home is a way of delivering a daycare experience to people living with dementia in their own home. Its main aim is to provide social and therapeutic activities such as music, reminiscence, arts and crafts, gentle exercise such as sit-fit, conversation, companionship, recreational activities, and all of these promoting continuity of care and support to as many of people living with dementia and their family carers as possible during this pandemic crisis at home. The daycare service at home reflects what is normally provided for the people living with dementia in the daycare centre. And we usually have carers who go in for maybe 2-3 hours a day. And again, like our home care service, they're usually the same carers that go in. So the families and the person living with dementia is familiar with them. You can see this gentleman here, he's having great fun out in the garden playing a racket game. And then after that, then the care worker said she had a delightful time listening to him playing his music. So the other service that we've always had within the ASI is our national helpline. However, they're extremely busy now due to our services being closed, the day centre services being closed. And we also have a nurse working on our helpline as well, and people can ring up and make an appointment to speak with the nurse should they have a specific query or a specific issue that it needs clinical advice. And then we also have our wonderful dementia advisor service, and they're extremely busy as well due to the day centres being closed. And all of those services can be availed through the national helpline. And we also have, I suppose, one of our more modern services, which is the live chat, where you can text in to another person within ASI helpline if you have a query or an issue. And you can see the different opening times there for those services. And of course, all that information is on our website. So just coming to the end of the presentation and wrapping the whole thing up, and what we have really developed and ensured that we could deliver to people living with dementia and their families since March of this year. We have daycare at home, therapeutic activity packs, national helpline and dementia nurse, virtual social clubs, dementia advisory service, social engagement and therapeutic activity phone calls, virtual sweet memories choir in collaboration with the HSE, and virtual cafes. So the Alzheimer's Society of Ireland has developed a robust, purposeful and meaningful suite of services for people living with dementia and their family carers at home. Thank you very much.
Thanks so much, Mary. A great overview of the work of the ASI. We just have a question in there about accessing the activity packs. Is that people phone the ASI helpline, is it, to get a pack sent out?
Yes, usually you can contact the local daycare service manager and they can arrange for the packs to be delivered locally. We have people who are going out driving around in cars delivering them, or we post them, and in some instances we email them. There is a link on the ASI website to order them as well. But if you have any issues, if anybody would like to order them, please, you can contact me as well and our helpline.
That's excellent. Thanks so much, Mary. And I have another question, a quick question there for Eibhlis in relation to robotics and the memory technology resource room and the Milo robot in particular. Is a robotics something that the MTRRs deliver around?
And I think I responded to that forever sent in that query, but the MTRs don't display robotic technology, even though we have looked at it, and I thought it's something that the MTRs are still, I suppose, in collaboration with some of the robotic companies looking at. Obviously, there's a lot of advantages to the robotics, but the MTRs decided that, I suppose, we had such a wide variety of other assistive technology that we were concentrating on what we had at the moment. But we certainly may well, I suppose, look more at robotics, because the area of assistive technology is so dynamic, and there's new equipment coming on board the whole time. So it is up, it's part of our remit to keep up to date with what's coming on board and new research that's going out there. But and I think, I suppose, in terms of the robotics, there's still a lot of research going on in relation to the advantages of robotics, and I suppose as well in terms of the ethical considerations in terms of the robotics. So that's still ongoing. So MTRs will keep up to date with that. And when, I suppose, that research and some of the, I suppose, ethical questions have been confirmed, we will certainly continue to look at, whether it's appropriate for the MTRs to have it. But we can still, I suppose, provide information on where people need to go to get to actually find out about them, just that we don't have the robots in the MTRs yet.
Okay, thanks so much, Eibhlis. And a question has come up. It initially was written up in relation to MTR and assistive technology, but I think it's relevant to the idea of care at home for everybody. And that's really managing, I suppose, the family carer's expectation of what they would like for the person at home and what the person with dementia would like themselves. And I just want to put that to the panel in relation to how do you address that? When the question was initially around the use of kind of surveillance or monitoring technology for people with dementia, when the person might not be aware of that being introduced into their home. But I think it's a question that is relevant across all supports. When somebody has dementia, if the family requests something and maybe the person hasn't been involved in decision making around that. So can I just put it first to you, maybe Eibhlis, around the tech side of things? How do you manage that, or how do you propose to manage that?
It's a very important question, and it's one that our MTR networks, or network of MTRs, we come together so many times a year, and we're constantly supposed to discussing, and it is a question that comes to the fore quite a lot, because it is a very important issue. And I suppose our MTR service would very much say that, I suppose, because we have that skilled professional, occupational therapists in most of the cases, who are skilled, I suppose, in dealing with this matter. First and foremost, their assessment is very much a collaborative assessment. So it's an assessment of the person with dementia and with the person with, so it's not something that's done independent of the person with dementia. So it's very much on what they want and what are their needs. And the MTR group themselves have looked, I suppose, at this ethical issue, and then we've actually attended training earlier this year. It seems such a long year with Kate Irving, and I know that she's speaking later on, and on that whole concept of the ethical issues. And I suppose really the MTR staff would work through that on an individual case by case, but they certainly wouldn't be putting in or advising on equipment in terms of surveillance without a person with dementia being aware and being involved in that whole decision-making process. But it is a very valid question, and I'm glad that it's come up, and maybe some of the other panelists have other ideas as well. But it's something that the MTRs are very much aware of, and I suppose they work with the person with dementia in terms of the collaboration. So I suppose.
Can I open? Yeah. Thanks, Eibhlis. Yeah, can I open it out to the other panelists? Does anybody else want to address that?
That whole issue of decision making and collaborative decision making is something that as a society we haven't really engaged with. They still seem to have this kind of idea that we're sovereign decision makers, that we can, fully and wholly make our own decisions about what we want for the future. And really we can't. And none of us make any decision independent of the people in our families, the people who love us. And sometimes I think, we can set these things up as two sides. The family wants this and the person with dementia wants this, when really I think a lot of the decision making is around trying to find the shared ground between the family and the person with dementia. Because, ultimately, most families, maybe not all, but most families want what's best for the person with dementia, and the person with dementia wants what's best for themselves. And trying to create a space, and this is what the OTs do, is trying to create a space whereby the person with dementia and the OTs can see each other's side of the story. Sorry, the person with dementia and the families, the OTs create a space where they can see each other's side, and it's really about finding the common ground between what the person with dementia wants and what the family wants. And sometimes that does mean some kind of slightly coercive tactics around kind of well, I know you don't think that you want this, but your family are really worried, and I know you don't want to worry your family, and so therefore could you entertain this as an idea for your family, if not for you? And I know, so slightly coercive, but it could be the thing that manages to keep the person at home. And that's another thing I'd often put to a person with dementia: if this is the difference between you staying at home or going out of your home, what would you prefer? And then you put it that way, they say, well, I'll stomach the camera, I'm not very happy about it, but I don't want to go anywhere else other than home, and I don't want to worry my family. And most people with dementia are deeply, that's one of the very, like, when you ask people with dementia what they want, they say, well, I want to still be me. That's the first thing. And then the second thing they say, I don't want to be a burden on my family.
Yeah, thanks so much for that, Kate. And just to say, we've been joined by Professor Kate Irving from DCU for the panel. So thanks, Kate, for that, who's quite an expert on ethical issues. So it's great to have your input there. Fiona, you wanted to come.
Yeah, the decision support service, which is due under is in development, the Assisted Decision Making Capacity Act. So that's a new service that'll be coming on stream, I think, next year. I know it's been delayed now for some time, but you know, that'll at least create a framework for that assisted decision making process, where, you know, somebody might need some external support in that decision making process. But again, as Kate said, you know, it's really best not to approach these as, you know, a kind of you know, a dichotomous either or, people in conflict. You know, I think if the approach from the outset is, how do we each work together to get the best outcome, which is what everybody wants. You know, it's if we can set things up that way from the outset, you know, it generally can kind of keep going that way.
Yeah, and I think that whole assessment of need is so critical in all of that, isn't it? Where people are involved when you're looking at need and you're capturing everybody's needs. Mary, do you have any sense there in terms of other services? ASI, as you've outlined, provide a huge range of services, and I'm sure sometimes it's the family carers that approach the ASI, and how do you approach that or manage any conflict?
Well, I suppose, I mean, all our managers and our care workers are constantly in contact with the family. So that's one thing that ASI have maintained since the COVID pandemic came down. We've maintained contact, and that's why we set up those phone calls. A lot of our family carers were saying, you know, they're worried that they'll be forgotten because they're in the home now and that services won't be provided to them, etc. We are trying to develop more support groups online and more social clubs and Alzheimer's cafes. And as time goes on, we will further develop them, but they do take time, and it's about educating people as well in the homes as to how to use technology that they've never used before. So it's actually, you know, a quite exciting time as well, because we're all learning new things of how to deliver service differently, but the impact for people living with dementia and their family carers in the home has been absolutely fantastic. The feedback has been great, and they really look forward to when the online services are about to take place. So it's just been a huge experience for all of us as well in ASI, but I think we're very successfully challenging the issues that the pandemic brought to us.
Thanks for that, Mary. And Fiona, do you have any, I know people with dementia are very involved in the campaign themselves, and you consult with them all the time, Fiona Foley. Do you have any sense around kind of any ethical issues that are arising around the work that you're doing?
I think for us always the key message there is that, you know, we see the person first and not the dementia. And so, you know, I think sometimes we forget that there's a person behind the diagnosis and what their wishes and their needs are, and how they want to live. And I think to me that is always the key for everything that we do. And sometimes if we just look at the diagnosis, you know, we might be putting things towards them and suggestions towards them that don't really fit their personality, or that they don't really want. And I think it is really coming back to who is the person and what are their wishes, and then finding that common ground. And I think many of the panelists now made that comment as well, is that finding that ground between the family and the person with dementia, having the communication lines open, and finding the best solution there. And I think key for us as well is that topic of communication, that, you know, on all levels, with all stakeholders, that we always try and involve everybody and communicate and look at how we can provide a support. And that's why all this, the work, the collaborative work also with the Alzheimer's Society, with other stakeholders, is really key. And just one thing to mention as well, because I know, like, we're focusing on work in the communities, and there's so much happening. There's so much happened even before, like, long before this campaign even started. And really to acknowledge that kind of work that has been, you know, on the forefront really of making a change, you know, for dementia in Ireland, and that just with the campaign, that we're just hoping that we can facilitate that collaboration and linking people together, and really building on that and giving it a voice as well, when sometimes it doesn't spread outside of a a village or of a meeting or so on, to really just help spread that, and that people hear the voices of people with dementia through that as well.
Thanks so much for that, Fiona. Mary, a couple of questions have come in about access to daycare at home. Is that just for clients who were attending daycare previously, or can new people seek that?
No, I think that's a great question. No, daycare at home is available to clients who were availing of the service before COVID, and it's also going to be available to people who want to just join our service now. So it's available to everyone. However, it will be done on a phased basis because we're trying to manage the demand. So anybody who wants to be assessed or to be part of the daycare at home service, you just need to contact your local Alzheimer's Society of Ireland daycare centre, and they'll be able to progress that for you.
Thanks so much for that. We've run a little bit over, but I think it was really worthwhile just to address some of those key issues, particularly the ethical issues, and I think we could have a whole session at the conference next year looking at that. But just to thank you very much to the speakers this morning. I think we've got a great sense of a kind of a changing environment and a changing landscape around caring for people at home. Outside of COVID, and then you add COVID to it, and there's a whole other dimension to that. So just thank you all so much for your time. Thank you all we had 80 people who sat in on the session this morning, so which is fantastic as a parallel session. It's great. So thank you all for joining. Lovely engagement in the chat box and the Q&A, so thanks for that as well. These presentations, I understand, Niamh, are going to be available to people, and there is going to be recordings of the sessions as well, so people can access it that way. So just enjoy the rest of the conference, and thanks so much, everyone. Again, take care.
Thank you.
Thanks. Bye-bye.
Thank you.
Bye-bye.